The next thing that we'll have a look at is the functional areas of the cortex. Now, the major thing that we have to, what used to be an important concept was the division between areas of cortex which had motor control and areas of cortex which had sensory control. And it used to be considered that these areas of the cortex had exclusive motor or sensory properties. But as recent studies have discovered, there is a concept of a sensory motor cortex instead now. So cortex has the ability to perform both sensory and motor functions. However, usually one or the other function predominates in its action. So basically, you can have areas of predominantly motor cortex, which is denoted as big M, little s, or you can have areas of predominantly sensory cortex, which is denoted big S, little m. And this may seem a little bit confusing, but I'll explain what this means as we go along. So the best thing that we can do to understand functional areas of the cortex is basically knock them down one by one. The first thing that we have to do, the first area that we need to cover is MS1. Now this refers to a predominantly motor part of the cortex, and this refers to what was previously known as the primary motor cortex. The MS1 is located on the cerebral hemisphere, predominantly in the precentral gyrus. Now, the MS1 is somatotopically organized, which means basically different areas of the precentral gyrus correspond to different areas of the body which are controlled. So generally what it is the leg and perineum lie further medially than the face and upper limb, which lie further laterally. The MS1 area of the cortex, or the primary motor cortex, functions basically through projections to the thalamus and basal ganglia, and also through projections directly to the spinal cord, known as cortico-spinal projections, which we'll talk about in more detail later on. The second area that we need to know about is MS2, and this refers to supplementary motor area, which is located on the medial frontal gyrus. Now, MS2 is important for postural control, as well as coordination and supraspinous control of muscle. The next area that we have to cover is SM1. Now, SM1 refers to a predominantly sensory area of cortex, and is located mainly in the postcentral gyrus. Once again, we have a somatotopic organization to this cortex, which means the arm and face are represented laterally, whereas the leg and perineum are represented medially. SM1 receives mainly tactile, kinesthetic or joint position sense, as well as vibration signals. The other sensory cortex, known as the SM2, located in the lower part of the postcentral gyrus, is the pain center in terms of the sensory cortex. So it receives most of the pain fibers which travel in the lateral spinal tracts, which we'll talk about later on. The final two areas of the cortex that we can see on these views include an anterior speech area. And the anterior speech area is also known as the Broca's area, and is located in the inferior part of the it's located in the inferior frontal gyrus, in the region of the pars opercularis and the pars triangularis. The anterior speech area is important in selection of words, and if you knock it out, so to speak, basically what you'll get is a motor aphasia. The patient will be still able to understand you, but they will find it hard to find words, so you often get a stammering kind of pattern. The other area that you can see on this view is the posterior speech area. Now the posterior speech area is also known as the Wernicke's area, and it lies basically where the supramarginal gyrus lies. And this is important for sensory perception of language. This is important for understanding. So if someone knocks this out, what you have is a sensory aphasia. So they have problems understanding words, and they often speak fluently, so they can string words together, but the words may not mean very much. So that's what you tell. So that's what they talk about with Wernicke's aphasia and Broca's aphasia, which you'll cover a lot in clinics. The next functional area of cortex that we need to know lies in the anterior transverse temporal gyrus. It's also known as the Herschel's gyrus, and this area is the cortical representation. Is the cortical area, which receives the auditory input. It receives binaural input, which basically means input from both ears. So if you knock it out, you'll have dampened hearing, but you won't have deafness on any particular side. It does receive predominantly crossed fibers, so the deafness is worse in the opposite ear, if it's detectable at all. Usually isn't that much of a difference between the ears anyway. The fibers reach the auditory area from the medial geniculate nucleus of the thalamus, and we'll cover this later on when we talk about the auditory pathways. The final thing that we need to know is areas of the cortex concerned with control of the eyes. The first area that we're going to cover is the visual area, and the visual area, it should be noted, lies around the banks of the calcarine sulcus. So they lie above and below the calcarine sulcus. So, yes, the calcarine sulcus. The area above the calcarine sulcus receives input from the upper retina, therefore the lower part of the visual field, and the part below the lateral, so the calcarine sulcus, receives input from the lower retina, therefore the upper part of the visual field. The entire visual cortex receives supply from the contralateral visual field. So the left cortex will receive information from the right visual field, and vice versa. The final thing that we should consider with the visual area is that more peripheral fibers are represented anteriorly, and more central fibers are represented more and more posteriorly. So therefore the macula, or the central part of the eye, is represented right at the occipital tip. The final area of cortex that we need to consider in terms of functional areas is the frontal eye fields. The frontal eye fields lie in the middle frontal gyrus and are responsible for initiation of saccadic eye movements. So it's basically like the eye movements in a particular direction, and it achieves this through projection to nuclei around the oculomotor nucleus, as well as to pretectal nuclei, which project to other areas of the brainstem to initiate eye movements. And that's it for now.